The social injustice problem that I chose was access to healthcare. Social injustice problems and issues arise and occur all over the world. This, there are literally millions of people around the world who do not have insurance, let alone proper access to healthcare. This topic interested me because I'm one of those millions of people that do not have access to proper health care. Due to lack of income, I do not qualify for the Affordable Care Act, let alone qualify for Medicaid. I want to talk to you a little bit about my experience. In the last 5 years, I have not been able to afford proper medical care. When I turned 21, I lost my Medicaid. When I go to the doctor, it's because I'm very sick and over-the-counter medications will not help. I know a lot of people are on Medicaid and Medicare, but for younger people such as myself, it's very hard to get Medicaid. I will go over that as well here in a few. I do believe that the government is very biased. I don't think that as a whole we are treated equally as far as health care. Each county, each state is ran differently. There is nothing in each county that I have found that runs the same. But I have found how we can help cut medical costs by using mathematics and economics. Economists look at everything, not just a small piece, but they look at a whole. Economists can help to improve human health at a sustainable cost, not only in the U.S., but globally. They look at all the factors. They look at things like how much they have to pay medical personnel. They look at what is affecting the high cost of insurance rates. Did you know in 2004, the United States spent $1.7 trillion on healthcare? Mathematics, how we can use that is if we keep a budget and have it set and use that and don't overspend. Like the hospitals and doctors' offices don't buy too much medication. Some of them will buy more than what is needed, and when that happens, if the medications or whatever they're using is out of date, it has to be thrown away and is wasted. I want to talk a little bit about Medicaid. If you're under the age of 21, you can get Health Choice, which is what I had. You can also get Medicaid at any age if you are blind or if you have been deemed disabled. There's also something called Pregnancy Medicaid, which they will give to any pregnant woman, that if you make under a certain amount, you can apply and get pregnancy Medicaid. They also offer family planning, which is what I have at the moment. Family planning it offers women such as myself 1 yearly physical and also birth control. If you would like to have birth control, that is offered. I put on here how to access health care. This is for the Affordable Health Care Act. You can go to this website and you can apply. The end date is December 6th to apply to get the health care through the Affordable Health Care Act. The reason why I was unable to obtain health care through the Affordable Health Care Act is because our income was too low. So you have to make a certain amount to be able to qualify. The very first place that I talked to for my project was the Mercy Clinic, which is in Asheboro, North Carolina. I spoke to a lady there. She agreed to talk to me, but only if I agreed not to mention her name or who she was. So I'm not going to put that information out there, but their phone number is over to the right. and you can call if anybody is interested. I want to talk a little bit about their facility and what they offer. They do have a sliding scale fee, which means that it is based off of your income. So I have never been to this facility, but they offer dental. It is not at that facility, but they can send you somewhere if you don't have insurance. Again, they have a sliding scale fee. They help pregnant women, which was amazing. They help kids and they help adults, which is awesome. Yeah, the next thing I want to talk about is Medical Ministries. Medical Ministries is located in Lexington and Thomasville. The facility to the right is new, and that is in Thomasville. It just opened this year. The facility to the left is in Lexington. I have visited that place. They also do the sliding scale fee. They have a pharmacy, which is really amazing, inside of their facility. They also have a dental facility inside of that building as well. They do offer just regular medical care. If you need to see a specialist, which was my problem at the time, I was unable to get that type of care at this particular place. I was on the waiting list for over a year, so I ended up having to save up $300 to go to my urology appointment to speak to those people for literally 15 minutes. So, a lot of people I know need mental health resources. So 3 that is in my local area, I've been to these as well: Daymark Recovery, Monarch, and Family Services. If I had to choose one of the 3, I would definitely choose Monarch. There's a 1-800 number there for Monarch. There is the facilities for Monarch. There is more than just one. The same with Daymark. Family Services, I think they are depending on your county. They have different for family services, but they will help you if you are in Davison County. That is the number there that you can call. They help if you have any type of mental disorder. Like for me, I have depression and I have anxiety. And they also help if people have drug abuse or any type of anything like alcohol, family problems. They help with that, and they do counseling. I want to thank everyone for watching, and I really hope that one day we can be offered better quality health care as well as affordable insurance rates. My hope is that our system will change and be more sensitive to those that cannot afford the high insurance rates. Through economics and mathematics, as I talked about earlier, I truly believe that if they work together, that things would change. Why not speak to those that do not have health insurance? I believe those that are creating bills would just step out of their offices and hear the public speak. A change could be made. Even if it's a small change. There are so many Americans that truly work hard and still can't afford health care. That really worries me. I hope in the years to come that all of this can be changed.